Hi friends, welcome back to Complete Medical Coding. Happy and prosperous New Year to all of my friends. Today I am here with mock questions, some important mock questions. I am really sorry, I am apologizing for not coming for few days because of my health issues. So today I am here with some important mock questions from previous year's examination papers. Okay, CPC mock examination papers. So friends, if you are liking my videos, please support me by subscribing to the channel and please share it among your friends. And my videos will be useful for those who are preparing for the examination as well as those who are preparing for the interviews. Okay, I'll be back with more and more interview questions as well in between interview videos. Also the sequencing videos. The same I did for CPT. I'll be coming back again with ICD, how to find codes from the code books. Also the sequencing videos. So everything one by one I'll be showing you. Okay. So today let's move to some more questions. So let's move to the first question. A 65-year-old with lymphoma is having an insertion of central venous catheter via the right subclavian vein. The catheter is inserted just below the right clavicle. Under fluoroscopic visualization, the catheter tip was placed in the superior vena cava above the right atrium. Dissection of the deltopectoral area was performed with cautery down to the pectoralis fascia level. The central venous catheter was then tunneled from the insertion site to the pocket and attached to a port which was placed in the pocket. The incision site is then closed. What CPT codes are reported? Okay, so here the what procedure is being carried out? The insertion of central venous catheter. Okay, so let's move to the codes directly because these are single codes you have to code only the CPT. So it will be easy for you. So just move directly to the options. The first code, first option, 36558. So just open the CPT code book and take 36558. This represents here, you have to check for the age also. The patient age is 65-year-old. So what is 36558? Insertion of non-tunneled centrally inserted central venous catheter, age 5 years or older. Okay. Is it non-tunneled or tunneled? In our description, it is tunneled, right? It's mentioned almost second last line. The central venous catheter was then tunneled from insertion site. So it means it's a tunneled centrally venous catheter. So you have to code for tunneled centrally venous catheter. So first code is wrong. What is 36569? 36569, insertion of peripherally inserted central venous catheter without subcutaneous port or pump, without imaging guidance, age 5 years or older. No, we have a port or pump and this is with imaging guidance under fluoroscopic visualization. It's mentioned in the question, third line, under fluoroscopic visualization. So this is under imaging guidance. So this code is also wrong. 36569, that is also wrong. What is 36556? 36556, that is again insertion of non-tunnel centrally venous catheter. So that is also wrong. Okay. And what is option D? 36561. Since we know that all the first three codes are wrong, obviously your answer will be option D. Still, let's look what it is. 36561. Don't blindly answer it. You have to check always. Okay. So what is 36561? Insertion of tunneled centrally inserted central venous access device with subcutaneous port, age 5 years or older. Yes, we have a port. We have a pump mentioned with port. See, on the second last line, the central venous catheter was tunneled from insertion site to the pocket and attached to a port which was placed in a pocket. So port is there. With subcutaneous port, age 5 years or older. Okay, so the answer will be option D, 36561. All right. Now moving to the second question. A complete cardiac MRI for morphology and function without contrast, followed by contrast with 4 additional sequences and stress imaging, is performed on a patient with systolic left ventricular congestive heart failure and premature ventricular contractions. What CPT and ICD-10 codes are reported? So this question looks simple, but you have to mark the correct ICD code and CPT. Okay. CPT, what procedure is being carried out here? A complete cardiac MRI. That's a procedure. Complete cardiac MRI without contrast followed by with the contrast. Okay. And then what are the diagnoses? 2 diagnoses are here. One is heart failure, congestive heart failure, and the other one is premature ventricular contractions. So you have to code for both. Okay. First, let's find out the CPT code here, which will be easy for you to answer this question, such type of questions. Okay. So go to the CPT code because it's a radiological part. So you can first find out the correct CPT code for the radiology code. Then you can easily save time. So what is 75563? The first option, 75563. Go to CPT book 75563. Cardiac magnetic resonance imaging. Yes, this is cardiac MRI. Okay. For morphology and function without contrast followed by contrast material and further sequences with stress imaging. Is there stress imaging mentioned here? Yes, it is mentioned. See, as exactly as mentioned in the description, in the question, it is there in the description. So, cardiac MRI for morphology and function without contrast followed by with contrast with additional sequence. With 4 additional sequence. Here in the description it is mentioned and further sequences. So, it means it can be 1 or more sequences. Okay. So, that number doesn't matter here. So, additional sequences and stress imaging. So, with stress imaging, the code will be 75563. See, so you already got the sorry. So, you already got the correct CPT code 75563, right? Still, if you want, you can check the other CPT codes as well, which is given in the other options. What are the other options? Other codes 75557, 75559. Again, 75561 in option C. What is 75561? That is in that code, in the code 75561, there is no stress imaging mentioned. So, you can't put that, mark that answer. It is mentioned 75561 and 75563 in option C. See, if there is a single code, single combination code, you have to use that combination code only. So, don't mark both the answer, both the codes 75561 and 63. Since there's a combination code 75563, you have to mark only that one, okay, and skip the other one. So option C is wrong. What about B and D? 75557 and 75559. 75557 is cardiac magnetic resonance imaging for morphology and function without contrast material. And then 75559 is with stress imaging. See, there is a similarity between these codes 75563, 61, 75557, 7559. Okay, but here in 75557 and 9, as you already know, here there is MRI for morphology without contrast material, but followed by contrast material is not mentioned in 7557 and 7559. Okay, in our question it is morphology MRI without contrast followed by contrast material and stress imaging, which is correctly mentioned in only one code, that is 75563. So obviously it makes your answer as option A, 75563. Still we will check the other ICD codes also. What is I50.20? We need 2 diagnoses. Left ventricular congestive heart failure and premature ventricular contractions. So what is I50.20? Go to I50.20. It represents unspecified systolic or congestive heart failure. That is right. And what is I-49.3? Ventricular premature depolarization. Yes, ventricular premature contraction means depolarization. Both are correct. So the correct answer is option A. Okay, 75563 followed by I-50.20 and I-49.3. Option A is the correct answer. Okay. Now let's move to the third question. The ophthalmologist tests the refractive state at the time of a comprehensive ophthalmologic exam related to an established patient's irregular astigmatism in the left eye. What CPT and ICD-10 codes are reported? So here the diagnosis is astigmatism. Okay, irregular astigmatism. And then what procedure is, what are the services here? The ophthalmologist tests the refractive state, means determination of refraction, the refraction point, the refractive state, identifying the refractive state, okay? And then at the time of comprehensive examination, comprehensive ophthalmologic examination. So you have to code for both comprehensive examination as well as the refractive state. And one more thing here in ophthalmological, there is one guideline in ophthalmology. For ophthalmologic office visits, you should not use the E&M code. Okay, if there is any direct code for that ophthalmologic visit or that ophthalmologic comprehensive, whatever it is, comprehensive or whatever detailed examination in the outpatient visit, in the office visit setup, then you have to code only that ophthalmologic code and don't go for the E&M code. Okay, so let's find out the answer. Go to the CPT code itself. Let's find out the CPT code first. Move to option A, 92014 and 92015. What is 92014 and 15? 92014 is ophthalmological services, medical examination and evaluation with initiation or continuation of diagnostic and treatment program, comprehensive, established patient one or more visits. See, 92014. Comprehensive, it means this is ophthalmological visit, examination, comprehensive, established patient one or more visit. So even if it is for one visit or more visit, you have to code only this one, 92014. So this is what I mean. So for all ophthalmologic office visit codes, you have to use either 92012 or 92014, depending on the description mentioned. If that matches with the question, then you should not go for the E&M code. See options B and C. There are E&M codes for established patient 99202 and 99204, which is wrong. Okay. Since we have the direct ophthalmological visit codes 92012 and 92014, you have to choose only whatever is applicable from those codes, either 92014 or 12. Okay. So here, since it is it's a comprehensive established patient code, you have to go for 92014. So don't go for those E&M codes which are mentioned in options B and C. 99202 and 204. Those are wrong options. So let's filter out the answer from either from option A or D. Okay. So what is 92014? As we already discussed, ophthalmological services, medical examination and evaluation with initiation or continuation of diagnostic and treatment program, comprehensive, established patient one or more visit. Yes, that is right. And what is 92015? Determination of refractive state. Yes, refractive state determination. That is the service which is performed here along with the comprehensive examination. So you have to code for both the service. Okay, 92014 and 15. Finally, what is the diagnosis? So in both the options A and D, 92014 and 92015, both are correct. Now let's find out the diagnosis, exact diagnosis. If it's either H52.212 or H52.202. So go to the ICD code book, I'm sorry. So in ICD book, what is H52.212? Irregular astigmatism, left eye. And H52.202 is just unspecified astigmatism, left eye. So both are left eye. In our question, it is irregular astigmatism. It is specifically mentioned as irregular astigmatism. So you have to go for H52.212. So which makes our answer as option A. The 92014. Yes, answer is option A. 92014, 92015, and then H52.212 for the ICD code. Okay. So I'm just repeating. If there is a ophthalmologic, if there is a direct code for ophthalmologic office visit code, you have to code only that and don't code for the E&M code for ophthalmological services. Okay. Now let's move to one descriptive question, fourth question. Okay. Actually, there are two slides for this question. So because this is such a big type, like history type descriptive question, you will definitely get such type of questions from musculoskeletal, respiratory, and digestive series. Okay, mostly from these three series. Anyway, let's move to the question. I'll just read out this first and then I'll explain you what needs to be done. So, pre-operative diagnosis, acute rotator cuff tear. This is the pre-operative diagnosis, okay, which is not a confirmed diagnosis. Acute rotator cuff tear. And what is the post-operative diagnosis? Acute rotator cuff tear and synovitis. See, two diagnoses. So these are the confirmed diagnoses. Acute rotator cuff tear and synovitis. Now, so if there is question that needs to find out CPT and ICD, then you got the ICD directly by looking it here. ICD you can mark it fast by looking in this descriptive question because it will be mentioned initially for few questions, not for all. For few questions, they will be mentioning the post-operative diagnosis, which is the confirmed diagnosis. So you can code it directly. But for procedure, for the CPT, you have to read out the full question. Then only you will identify. Okay. So I'll read it out for you. Procedures. First procedure, rotator cuff repair. Second procedure, biceps stenodesis. Third, claviculectomy. And fourth, for acromial ligament release. So three procedures you have to mark it here. Indication, rotator cuff injury of a 32-year-old male sustained while playing soccer. Findings, complete tear of the right rotator cuff, synovitis, impingement. Procedure, now the history of the procedure it is mentioned here. Okay. Procedure. The patient was prepared for surgery and placed in the left lateral decubitus position. Standard posterior arthroscopy portals were made, followed by an anterior superior portal diagnostic arthroscopy was performed. So arthroscopy procedure is there. Okay. When you are reading the question, if you are coming across few points, you can mark it there with the pencil while examination. Okay. So here arthroscopy of left lateral arthroscopy. Yeah. Now, significant synovitis was carefully debrided. There was a full thickness upper third subcapillary tear, which was repaired. The lesser tuberosity was debrided back to bleeding healthy bone, and a Mitec 4.5 mm helix anchor was placed in the lesser tuberosity sutures were passed through the subcapillaries in a combination of horizontal mattress and simple interrupted fashion and then tied. All these are the history of the procedure, how the procedure is being carried out. There was a partial thickness tearing of the long head of biceps. The biceps were released and then anchored in the intertubercular groove with a screw. There was a large anterior acromial spur with subacromial impingement. A CA ligament was released and acromioplasty was performed. So another procedure, acromioplasty. Attention was then directed to the supraspinatus tendon tear. The tear was V-shaped and measured approximately 2.5 cm from anterior to posterior. Two Smith and Nephew peak anchors were used for the medial row utilizing helicoli and anchors. Side-to-side stitches were placed. One set of suture tape from each of the medial anchors was then placed through a laterally placed Mythic helix peak knotless anchor, which was fully inserted after tensioning the tapes. A solid repair was obtained. Next, there were severe degenerative changes at the AC joint of approximate 8 to 10 mm. The distal clavicle was resected, taking care to preserve the superior AC joint capsule. The shoulder was thoroughly lavaged. The instruments were removed and the incisions were closed in routine fashion. Sterile dressing was applied. The patient was transferred to recovery in stable condition. What CPT codes are reported in this case? So here you have to identify only the CPT codes. They have not asked the diagnosis. If they have asked the diagnosis, again see that sequencing length, it will go on, it will increase. But it's easy to find out the diagnosis. Anyway, let's find out the CPT codes here. So here, where is the procedure carried out? Here the procedure is carried out in the shoulder, right? Clavicle bone. See, at last it is mentioned the shoulder was thoroughly lavaged. So in the shoulder, the procedure is carried out. Anyway, let's move to see if you check the options. Almost everything in all options, the codes are same, right? So it will be little bit easy for you to identify the answer. See, in such type of questions, you have to go directly to the CPT codes and find out the answer from that. Otherwise, you will get lot of time, like waste of time, spending so much of time in one question. Okay, see, after reading the question itself, see my time, it's almost 6 minutes. Okay, not 6 minutes, at least 4 minutes it will take for you to read and understand the question. So move directly to the option. It is the first code, first option, first code 29827. Let's sort it out, or each and every code which are needed or not. Okay, so what is 29827? Go to the option, the code 29827. Let's find out if you really need that code. 29827. It represents arthroscopy of shoulder, distal claviculectomy with rotator cuff repair. Yes, this is arthroscopy of shoulder with rotator cuff repair. We have already read rotator cuff repair. Also, it is marked in the first under the procedure. See, initially this beginning of the question. In procedures, it is marked rotator cuff repair. So this is the code for that, rotator cuff repair of shoulder arthroscopy. Okay, so we need that code. Now, what is the second code? 29824. What is 29824? Again, 29824 represents, it's too long to find out. Yes, 29824, 823, 822, 821, 820. Where is the starting of this one? 19. See, 29806 is the starting here. So 29824. What is 29824? Arthroscopy, shoulder, surgical, distal claviculectomy, including distal articular surface. Claviculectomy. Distal claviculectomy. So you have to code for distal claviculectomy code, which is in 29824. That is, see, in our third, in the under the procedures, third point, claviculectomy. So you have to code that. So 29824 is the correct code for distal claviculectomy, including distal articular surface. So 29824 also required. I'll tell you about the modifiers later. What is 29826? 29826. 29826. Yes. 29826 is arthroscopy, shoulder, decompression of subacromial space with partial acromioplasty with coracoacromial ligament release when performed. Ligament release when performed. Yes, we had read the same line in the first slide, almost in the mid, I think. See, there was a large anterior acromial spur with subacromial impingement. A CA ligament was released and acromioplasty was performed. Yes, acromioplasty. So we need this code as well, which represents this is a multiple procedure, right? They are doing multiple procedures. The doctor is doing multiple procedures. That is why they have marked. That's why we need to mark the modifiers 29824 with 51 because it's a multiple procedure. 824 and 826 because both represent arthroscopy of shoulder. Both are arthroscopy of shoulder, but it's a separate procedure. That is why 51 modifier is being appended here. Okay. Now, finally, what is 29805? Again, 29805 represents arthroscopy shoulder diagnostic with or without synovial biopsy. Here, synovitis is there, right? Synovitis is the diagnosis with or without. If it is there or not, you have to go 29805 with or without synovial biopsy. Here, synovial biopsy is being carried out. So, we need that code 29805 for that synovitis procedure. So, there again, it is arthroscopy of shoulder. Okay. So, again, arthroscopy of shoulder is there. And then synovitis was, see, almost in the 5 to 6 lines from the beginning in the question, it is mentioned significant synovitis was carefully debrided. There was a full thickness upper third subcapillaris tear which was repaired. Lesser tuberosity. So, along with that procedure, the other procedures are carried out. Okay. So, that's also separate procedure. So, along with that procedure, synovitis procedure, they have carried out the, what other procedures are there? Claviculectomy, coracoacromial ligament release, everything. So, that we already got those codes. Claviculectomy and coracoacromial ligament release, we got the code as 29824, yes, and 29827. Yeah. Okay. So, here, sorry, 29826. So, here now, you have to mark 29805 also along with modifier 59 to represent it as a distinct procedural service. Along with the other procedures, they are carrying out a distinct service in the shoulder. So, you have to mark 59 modifier. Okay. So, these are the 4 codes that we needed. And this is how the modifiers have to be marked. So, you got the answer as option A. If you want, you can check the other CPT code also in option C and D. That is 29828. That is biceps tenodesis. Biceps tenodesis. Yeah. Biceps tenodesis is also there. Which is the second procedure mentioned. Okay, so 29828 is the code for biceps tenodesis, which is in the second procedure. So, which are the procedures? The first one, we got the code for rotator cuff repair. Okay, that is 29827. And then biceps tenodesis. Now, you got the code for biceps tenodesis 29828. You have to mark it with modifier 51 to represent it as a multiple procedure. Okay. Again, 29824 and 29826 both are same. I think I had mentioned before that you have to append with modifier 51 for both. No, For multiple procedure, you have to append modifier 51 only to one procedure. Okay, not to both the procedures. See, as in option C, 29824 with modifier 51 and 29826, no modifier. And then again 29805 with modifier 59 to represent it as a distinct procedural service. 805, what is 805? Arthroscopy shoulder, yes, with synovial biopsy. So here the correct answer is option C, 29827, 29828 for biceps stenodesis. If you check option A, there is no biceps stenodesis code marked. So that is wrong. So correct answer will be option C. And if you check the codes 29824 and 826, append only one code with modifier 51 to represent it as a multiple procedure. So answer is option C here. Okay. I know that you will be getting some confusion while reading, while finding out the answer. You can mark it in the comments. I will reply back to you soon. Okay. Now moving to the fifth question. A 5-year-old patient is brought into the emergency department by her mom with a fish hook that has punctured her in the right elbow. After much manipulation by the ED physician, the hook removal was unsuccessful. The ED physician uses a 11 blade to make a small incision to the subcutaneous tissue in getting both barbs easily removed. Both wounds were cleansed profusely with soap. Dry sterile dressing applied. What codes are reported? So here you have to mark for both CPT and ICD code. What is the ICD? Fish hook. You cannot say it as a fish hook. In the description it will be like foreign body. Okay, foreign body is punctured in the right elbow. And what is the procedure carried out here? Subcutaneous small incision. Initially, the emergency department doctor was done what is that? Puncture manipulation, but it was unsuccessful. Then he made an incision. So I and D, incision and drainage, you have to code here. Okay, so let's find it out. What is the first CPT code? If you check the options, there are only two CPT codes, 10121 and 10120. So let's find out which is the correct one. What is 10121 and 10120? 10120 is incision and removal of foreign body subcutaneous tissue, simple. And 10121 is same, incision and removal of foreign body subcutaneous tissue, complicated. Is this? Now you have to find out from the question whether the procedure carried out here is a simple one or a complicated one. See, to make you find out or to make you understand whether it is a simple or complicated, that is why it is mentioned in the question. Initially, the manipulation done by the emergency department physician was unsuccessful, and then later he made an incision. So it means this is not at all a simple procedure. This is a complicated procedure because two sutures were there. I mean, two wounds were there, right? Two wounds have been made like for the incision procedure. So initially, since it was unsuccessful, that is why, initially the procedure was unsuccessful. It means the simple procedure was unsuccessful. That is why he had made an incision. So this is complicated procedure. So the correct CPT code here will be complicated code 10121. Complicated code. You have to code here. So 10121, that is in options A and D. So from that you can find the ICD. So 10121. What is the ICD code in options A and D? S51.041A. Anyway, ICD also, there are only two codes here. S51.041A or S50.351A. Let's find out which is the correct ICD code. What is the first one? S51.041A. Puncture wound with foreign body of right elbow, initial encounter. And what is the other one? S50.351A. Superficial foreign body of right elbow, initial encounter. This is not superficial, this is puncture wound. It's clearly mentioned in the first sentence. Punctured in her right elbow. So this is puncture wound. So correct ICD code will be S51.041A. Okay, so here the correct answer is option A, 10121, and diagnosis S51.041A. Okay. So friends, these are few important mock questions. I hope you had understood. If you have any queries, any doubts, you can mark in the comments. And from now onwards, I'll be frequently coming back with the videos. As I told you initially, I was having some health, like small health issues. That's why I couldn't speak up. So that is the reason. Few videos were delayed since 2 weeks, I think. So from here onwards, I'll be back with more questions, more guidelines, more and more chapter wise guidelines. Again, I'll be reviewing it, or more guidelines. I'll be coming back with like chapter wise guidelines again. Along with that, some interview questions, interview preparations, as well as exam preparations. Okay, how to easily pass the exam, how to save time, how to find the codes from the CPT code book as well as ICD code book. What are the sequencing, how to do sequencing in ICD. ICD sequencing is important. Okay, so how to do ICD sequencing, everything. In between, we will learn, we will do some practice questions as well. Practice questions, mock questions. And I'll be coming back with live mock questions as well. Live mock questions means I'll be here with few questions. I'll give some specific time. You have to read it out in that time and then find the answer within that specific time. Okay. Anyway, let's find out. These are my, agenda. Like coming agenda videos. So now, as of now, if you have liked the video, if you have understood, or if you are understanding my classes, my videos, please support me. Please subscribe and please share it with your friends. Okay. So thank you so much, friends, for those who have already subscribed, those who have passed examination by listening to the videos. I'm getting few queries. I'm getting few comments also like that. So thank you so much for all your support, and please continue supporting me. Once your exam is also done, please continue watching my videos so that you will be getting interview questions also. I'll be coming with videos, preparing videos with interview questions also. Okay, because the questions which are in the examination is entirely different than interview questions. So I'll be coming with those videos as well. So stay tuned, friends, for more videos. And thank you so much for all your support. Bye. See you in the next episode. See you soon.